Hello, I'm Jacob Turmell and I'm the Chief Clinical Officer for Hospital Patient Monitoring. I'm excited today to show you a demonstration of our central monitoring unit. To set up the situation, we have on this side the patient room and we have our central monitoring station on this side. We're going to trigger an alarm. In the room, the monitor is going to stay quiet, but the alarm is going to go to the central station. The monitor tech is going to review that alarm, and they're going to look at clinical decision support tools to help them decide, is this alarm meaningful, and if it's something that I need to send to the nursing staff. So two of the clinical decision support tools that they're looking at first is Horizon Trends. Horizon Trends tells me, is the parameter going up, is it staying the same, or is it going down? The monitor tech can quickly look at that and make a decision on that parameter to decide if it's something they need to notify the nursing staff on. The other clinical decision support tool that we have on the monitor that the monitor tech can review is ST-Map. ST-Map tells us, are my ST segments changing? Is my patient at risk for having a heart attack? And very quickly they can look at that. If it turns red, then there's a problem with the patient that they need to notify the nurse about. So the monitor tech is going to review the alarm, review the clinical decision support tools, and review the rhythm strip. And in this scenario, they decide it is not something that needs to be sent out to the nursing staff, so they're just going to click the X and close that. So now that we've reviewed that first scenario, I want to show you an alarm that goes off where the monitor tech needs to send that to the nursing staff. So an alarm is going to go off in the room. The room stays quiet, but the monitor tech sees the alarm on the central station. They review the alarm and they decide this is something critical that the nursing staff needs to know about. So they click the pager button to send that out to the nursing staff. So now that they've sent that out to the nursing staff, the nurse is going to get the alert on their mobile device through Care Assist. The nurse is able to see the context of the alarm so they can decide if this is a priority or something they can wait to react on. The nurse can click on the icon and go in and see a near real-time waveform, again, to help them with their prioritization. Because we have bi-directional communication in our monitoring system to our mobile device, the nurse can silence that alarm, which silences the central station. The nurse can also check a blood pressure on the patient as they're walking to the room so that they have all the information they need to take care of the patient when they arrive at their bedside. So I'm just going to click back and I am going to accept my alarm. After I've accepted the alarm, the monitor tech has a view where they're able to see exactly what's happening with that alarm. They can see what nurse accepted it, so they know that someone is taking care of that alarm. So now I want to show you a scenario in which the nurse might be busy. Maybe they're in with the patient having a caring conversation, maybe they're in isolation. So an alarm is going to go off in the room. And the monitor tech is going to see the alarm and review the rhythm strip. This time when they page out that alarm, it's going to go to the nurse, and the nurse has the ability to push that alarm to their buddy. Or it can go out automatically after a certain amount of time if that nurse is busy. All the while, the monitor tech is able to see exactly what's happening with that alert to know that somebody is taking care of it. This is a view of what our system will look like in the future. So instead of having a separate screen, the monitor tech will be able to track those alerts right here on the central station and see what's happening with the alert. So now that the monitor tech has been able to see that somebody is taking care of the alarm, the next thing that we're going to work on is getting patients off of the monitor. So we want to have a list of patients that at 48 hours have been arrhythmia free. And we have that with our telemetry insights manager. So the nurse is reviewing this list and they can see that this patient has had no events over the last 48 hours. So they're now ready to come off of the monitor or possibly be discharged with home monitoring. So thank you for listening to our presentation on the CMU simulation.